In South Africa, the commonest risk factors are diabetes and hypertension. In addition, risk factors include older age, cigarette smoking, the use of pain medication for chronic arthritis or other pain conditions, and then people who have cardiovascular disease or a strong family history of kidney disease. In the initial stages of chronic kidney disease, many people may not have any symptoms, but as the kidney disease worsens, they may feel tired, they may start swelling up, they may have itching, they may have difficulty sleeping, they may have difficulty breathing or feel short of breath when they're doing activities. So if you are at risk of chronic kidney disease, it's important that you take steps to mitigate that risk, to prevent you from developing kidney disease as time goes on. This would include steps like not smoking, having a healthy diet, reducing the amount of salt in your diet, making sure you drink enough water, avoiding large amounts of protein, particularly animal protein. And at the same time, if you have a chronic condition like hypertension or diabetes, it's important that you follow the advice of your medical practitioner, take those lifestyle steps which you need to take to control those, as well as the medication that you require to control those. Diet is a critical element of management in patients with chronic kidney disease. Having a good diet can reduce the symptoms of chronic kidney disease, but can also slow the progression of chronic kidney disease. One of the major elements would be reducing the amount of salt one has in your diet. In general, your kidney is able to remove excess salt which one may have in your diet, but if your kidney is not working so well, that salt accumulates. So if you reduce the amount of salt in your diet, it can prevent things like swelling, it can improve the control of your blood pressure. The second thing one should really reduce is protein, particularly protein from animal sources. Usually protein comes together with a lot of other toxins, and if the kidney can't handle it, this can increase the symptoms of chronic kidney disease. At the same time, high protein diets have been shown to accelerate the progression of chronic kidney disease. The other elements which may become very important as one reaches the end stages of chronic kidney disease include reduction of potassium and phosphate in your diet, and one should probably take specialized dietary advice from a dietitian or from your physician at that stage. Chronic kidney disease can be detected using a simple blood test. We test for a toxin called creatinine, which usually comes from muscle in your body, and as your kidney function worsens, the creatinine level rises. We then can use the creatinine in a formula for something called the glomerular filtration rate, and this corrects for the amount of muscle you have and is much more scientific and easier to follow up over a long period. If you have chronic kidney disease or are at risk of chronic kidney disease, your practitioner will monitor your blood test looking at the creatinine levels or the glomerular filtration rate, or GFR, and then using these tools they will be able to determine how rapidly the kidney disease is progressing and whether they need to intervene or change your management. The normal GFR is around 90 to 100 mils per minute, but as your kidney function worsens, you may end up needing dialysis if your GFR falls under 10 mils per minute or if you have symptoms. How regularly or how often your doctor needs to monitor your GFR will depend on how severe your kidney function is and what is causing the damage to your kidney. In addition, doctors will often monitor the amount of albumin or protein in your urine using something called the albumin to creatinine ratio or protein to creatinine ratio. This involves taking a urine specimen and sending it to the lab. This will give you further information as to how high the risk is of progression of your chronic kidney disease and whether the treatment is working. If you are at risk of chronic kidney disease and your practitioner explains to you that your kidney function is worsening or is abnormal, it may be necessary for you to see a specialist nephrologist or physician. If you have not been told anything about your kidneys, but you have some of the symptoms which were mentioned, including swelling, itching, shortness of breath, extreme fatigue, then it may be necessary for you to see a general practitioner. Your general practitioner may then refer you to a specialist nephrologist or a physician. If you have chronic kidney disease, our first goal is to try and prevent you from developing end-stage kidney failure. However, if you do develop end-stage kidney failure, which is life-threatening, then the options include dialysis, either hemodialysis or peritoneal dialysis. However, the best option is probably a kidney transplant. There are two ways to get a kidney transplant. The best option would be to get a kidney transplant from a related living donor or another person, a friend, or an altruistic donor. Alternatively, you can get a kidney transplant from the waiting list, but you may need to wait quite a long time. There are other treatments which people have been promoting, including stem cell therapies or other herbal therapies or non-conventional therapies, but there's no evidence to show that these are able to reverse established chronic kidney disease. Traveling while on dialysis is usually easier when you're on peritoneal dialysis because there's no need for you to go to a dialysis unit. However, even if you are on hemodialysis, there are dialysis units available almost everywhere in the world. It does take a bit of arrangement in advance to make sure that the dialysis unit at your destination is expecting you and is prepared for you. But if you arrange it in advance and you give sufficient time, there shouldn't be any problem traveling almost anywhere in the world. There is an element of cost which may be involved in certain countries because your medical funder may not fund the cost at the same level as they would in South Africa. Hemodialysis is not the same as the normal amount of work that your kidney does. In general, hemodialysis will do between 15 to 20% of what your normal kidneys would be doing because it's intermittent, it's not continuous. That means you should dialyze as frequently as possible. But as you know, if you dialyze every day, it becomes very costly. Also, it becomes very inconvenient. You have to live your life. So as a balance, most people need to dialyze approximately 3 times a week to make sure that they're having enough toxin removal and have enough opportunity to remove excess fluids. If you are passing quite a lot of urine and still have what we call residual renal function, that means your own kidneys are still doing a significant amount of work, you may get away with dialysis less frequently, like twice a week. Very occasionally, especially if you have severe cardiac disease, you may need dialysis even more frequently than 3 times a week, 4 or 5 times a week, or you may need very prolonged sessions. Your practitioner should guide you as to how often you will need dialysis. Chronic kidney disease is one of 25 conditions which is a prescribed minimum benefit condition. This means that medical aids must provide benefits as a standard of care, including all stages of chronic kidney disease, which will include medical therapies, dietary therapies, as well as dialysis. If you reach dialysis, your medical aid will approve dialysis for you. Some medical aids may approve it at any dialysis center. However, other medical aids may only approve it at a preferred provider. Dialysis is only part of the treatment for end-stage kidney failure. While dialysis removes the toxins, it can't remove all the toxins which accumulate in your body, and it also cannot correct some of the other abnormalities like the abnormal high blood pressure or the accumulation of fluid. One needs to at the same time adjust the diet and lifestyle to make sure that you reduce the amount of work that's needed to be done by dialysis. You will need to reduce the amount of phosphate and potassium in your diet to prevent them accumulating because they are not easily removed always by dialysis. You will need to take phosphate binders and vitamin D to prevent the complication of metabolic bone disease associated with chronic kidney disease. You may also need to take erythropoietin, or EPO for short. There are various forms of EPO and they will be prescribed to you by a practitioner if you have anemia related to chronic kidney disease. Sometimes you will need to take iron in addition to the EPO. Chronic kidney disease is on the rise around the world because of an epidemic of hypertension and diabetes and lifestyle diseases. HIV is also a risk factor for chronic kidney disease. It's important to try and prevent the progression to end-stage kidney failure because once one has end-stage kidney failure, the options are limited. A kidney transplant would be the best option for one with end-stage kidney failure. Unfortunately, there's a major shortage of donors around the world. We should encourage our family and friends to register as donors and to consider donating their kidneys.